Hi there, welcome to my Audiovisual Learners. So this is essentially your to-do list in visual audio format. So to help you get ready for your next clinical day, the first thing you're going to want to make sure you do is you do your homework from last week. So you'll see that I've created a homework folder. It's a very short list. You'll go under homework due for week number 2. It's a short list and it really won't take that much time. The first thing you're going to see is reply to the discussion form around understanding the MPET. So I've created a discussion form, and you'll see that the instructions have changed a little bit from orientation, and this was in no way meant to trick you. You will see when you went home to maybe answer some of those questions, you might have realized, well, the MPET doesn't actually answer these questions. Fantastic, I wanted you to see that. So what do you do when you've been, given instructions to read something, but reading doesn't always equal understanding? So how can you advocate for your learning needs? What questions can you ask? How can you approach your instructor to figure out exactly what it is you need to provide? And if the information's not there, how do you ask for that? So I've provided one example of a question you may ask, and what I want you to do is brainstorm and think about other ways that you may articulate to your instructor that the resources that you've been given to complete an assignment aren't actually complete. So you're going to reply to the comment that I've put in there and think about how you might approach that situation. The next thing you want to do is you want to review professional image and infection control, because remember those were the first 2 theory and lab classes that you had. So how do we now bring those into the clinical environment? So you will see that I've created a supports for homework folder, and in there you're going to see a recommendation around 2 pages of reading in your Potter and Perry textbook. So that's this application of knowledge piece. You'll also see that I've uploaded a couple of short YouTube videos that have been created by previous nursing students around professional image, and you might enjoy those. The next thing you're going to want to do is you're going to want to read core competency number 5 in your MPET. That's the one we're going to be reviewing during post-conference. You want to define a transition unit. So what is a transition unit in a healthcare setting? And you'll want to bring that definition with you because we'll be reviewing that in post-conference as well. And the last thing you want to do is you just want to review the plan for week number 2. So whether you look at the activities in the clinical focus plan, or whether you just hear auditory. So the first thing we're going to be doing is a hospital tour. So kind of a heads up. Oh, what exactly does that look like? It's not going to be boring in the least. So maybe to prepare you for that, you might want to think about what's in a typical hospital. What are the typical departments? What are the areas? Who are the people who typically work there? Then you're going to see that we're having a nursing unit tour. So in your mind, what does a typical nursing unit look like? What are some of the areas that you're going to see on a nursing unit? Particular rooms. Think about those things. The next thing you're going to think about in terms of a treasure hunt is you'll be generating lists of what supplies do you think are found on a typical hospital unit. So think about the things that you'll be doing as a first-year student, bathing patients, feeding patients, moving patients, etc. And think about, well, what supplies will I need to do those things? The last thing you want to make sure is to bring your basic first contact card. So basic first contact, think about what are the things you're looking for when you first see a patient, and what are the things you're looking for when you first walk into a patient's environment. So these are just things to think about ahead of time, just to kind of give you a heads up so that you're not nervous offering your ideas and your suggestions. So it's going to be a fantastic day. I will see you in the main lobby at 8 o'clock. Okay, have a good one.